Lagos State Commissioner for Health, Professor Akin Abayomi, says Lagos Island has the highest number of suspected cholera cases, with 106 cases out of 350 suspected cases in the state. Abayomi disclosed this on Monday through his official X account, and says the state's cholera outbreak, according to the World Health Organization, is an acute diarrhea infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. Cholera can cause severe acute watery diarrhea and severe forms of disease that can kill within hours if left untreated. That's what we are looking at this afternoon on the program Insight. Today, my name is Anthony Momodi. Welcome to today's edition. As it's been said that over 30 Nigerians have lost their lives due to the spread of cholera, which just hit the nation recently across 30 states of the Federation. And that's why we've thought it necessary to look at it on today's edition of the program Insight. Today, I have a guest in the studio, Jogba Musa, who is a health professional. He's called a nurse, and he's from the Health Spring HMO Limited, right here in the Federal Capital Territory, to help us look at this very disturbing occurrence making the rounds. Musa, nice to have you join us in the studio.
Same here, thank you.
All right, you're looking not worried, but Nigerians seem very worried as regards the cholera outbreak. Lagos has turned out to be the epic center. As much as 1,141 suspected cases have been, recorded, with 65 confirmed, 30 deaths in 30 states of 36 states of the Federation, with 96, confirmed. And how worried should we be when we're talking cholera?
Yeah, I would say we should be somehow worried because especially now that the economy is very, very difficult, and looking at the fact that cholera has its way of getting into people's body, and there are several ways which we can get this cholera, especially with this weather, this season that we are, which is raining season. And one of it is drinking of infected water, and another one is using infected water to cook the food that we eat. And also we also have another form in which this deadly, let me use the word hypothetically, a deadly disease can get into our body eating uncooked or improper food that's not properly cooked food. Thank you. Yeah, right. So especially the shellfish. And looking at Lagos, for instance, that the cases have been so alarming. Look at their environment. Sewages are blocked, and there's no proper sewage in Lagos. The waters are dirty, especially go to is it Lekki, they call it, or VI? I think it's Lekki. Yeah, whereby they don't have a clean water. So these waters can be easily infected. And looking at open defecation that is everywhere, it can easily be transmitted. And
okay, let's understand the word cholera disease. What is cholera, first of all? Probably that will help us understand better as we go forward in our discourse. For cholera, how would you describe it?
Okay, cholera is an acute diarrhea disease that is caused by Vibrio cholerae, and which is mainly common during the rainy season. Okay. Though there are few cases during the dry season where there are no water, people struggle to get water, and any available water they get to drink is some places where there are no water. So that is what cholera is all about.
All right, let's look at, we're talking cholera now. How do we know, like, the symptoms? So what are the symptoms, already symptoms that we can see, and you can say, okay, this is cholera playing out here?
Okay, some of the symptoms are severe dehydration, there is vomiting, and there is stooling, that is diarrhea. So okay. Those are the basic that we normally look at when we want to diagnose cholera case.
Okay, in terms of the body structure, the mass weight index now, talking real science, adults, children, and adolescents, who easily gets hit, with cholera easily, who does it break down easily. And you use the word acute. When you say acute, means that's the highest level when you say something is acute.
No, when we say something is acute, you're looking at something that is sudden.
Okay.
Yeah, something that is sudden. When the disease, when the what was it called, the bacterium enters the body, the effect is sudden.
Okay.
So it's a sudden occurrence. That's why we say acute. And then looking at your question about the children, the adolescents, and the adults who are more to be susceptible to cholera, I would say the children. One, because of nutritional balance, we look at it. Then we look at their immunity too. They don't have strong immunity, and we look at their hygiene. Children tend to play, especially those that are crawling and all that. So the three basic things that can make children to be more susceptible are the hygiene, nutritional status, and immunity.
Okay. Let's looking at. We know that you talked about the sanitation and hygiene seem to be two key factors from all you said thus far. Yes. How key are these two factors? Aside the weather, the rainy season which we are in now, how key is hygiene and the sanitation of the environment for people out there to know?
Okay, let me first of all talk about the sanitation. When we tend to block the sewage, and let me use the street word gutter. If you tend to block the gutter, when it rains heavily, the rain will not be able to flow through the gutter, and you see that the gutter is blocked. The water is spread across.
Some of this water, those debts.
Exactly, and some people are still using pit latrine, and once this water goes into the pit latrine, it might get full and the water comes out. So we don't know. Maybe probably somebody that is infected has defecated in that place and it spreads, and people tend to fetch water from the rain and all that. They won't care to bother about the source. The source of the water. They'll just kind of be packing the water in their storage.
So in terms of suburban areas and the slums and the urban areas, which areas can we readily see lots of infections or spread occur more?
I would say the slum, because
so population and how dense the area is a factor.
Of course, yes. Population also play a very key role, and why I'm saying slum is because if you look at, let's use Lagos State as a case study. Look at the slum in Lagos. Like almost all the water in Lagos, I don't know if you have noticed it, they are dark, they are black. These are water that's mixed with canals and all that. So I would say slum people who live in slum area are more susceptible to this illness. Then looking at population, for instance, let's take the IDP as a case study. Look at the population in the IDP. Source of water in the IDP is limited, and because of that, people tend to use water in a ration way, whereby they don't get to cook, wash the food they cook very well, and they drink whatever comes their way because they are thirsty. So population plays a very vital role in spread of cholera. Okay,
looking at Lagos, since we are focusing on Lagos as our case study, turning out to become the epicenter of cholera currently, how best do you think it can be managed, especially with an eye to the fact that schools are almost about to resume?
Yeah, I think what the government, because I think it's the government that can do the major thing now. What can be done is deploying surveillance tool that can easily detect the conditions. Then another thing is awareness. They have to do a lot of jingles, a lot of public health awareness for people to know the cause, the signs, the symptoms, and the prevention of this particular disease, which is cholera. So I would say basically what we need is just deploying the surveillance and public health awareness, and of course, if possible, if the government can give vaccines.
Okay,
So,
yeah, that's where I was coming to in terms of treatment. The report tells us that if not immediately treated, it could lead to loss of lives, means it could kill within hours. Let's look at the treatment, the action plan for treatment of those with cholera. How easy, affordable is it? Because you mentioned the fact that because of the economic situation of the country, it could be very dicey. What's the treatment plan and cost implication like?
okay, I would say the treatment plan is moderate because there's what we call oral rehydration salts, which is I think I won't be able to get the exact amount,
but just the range.
Okay,
Yeah.
it should be between 100 to 150 per sachet. So we can use that as immediate intervention. That is, if you are doing home treatment, then going to the hospital, the medications are not that expensive.
All right, so it's something affordable.
Affordable,
Okay,
yes.
we notice that when the government talks about cholera, they talk about 100 and like 1,000. In the case where they said 1,141 suspected cases, then they come up with just 65 confirmed cases. Why is the disparity? We only see suspected cases on a very large volume, then they come and tell you, okay, why is that? Is that the monitoring tools that give those statistics, or government just uses, or the health professionals use those terms to probably make people more cautious?
I won't really say.
Just like we saw during the COVID time,
period,
when they
yeah.
said 10,000 persons have got COVID and all that.
Yeah, I won't really say that is what's played out or is playing out. When you come to the clinic, that is the hospital, there are signs that must be seen before they tag you as a suspected, because
Yes.
no one can confirm it unless individual test has been carried out on individual from the laboratory.
So the labs are very important at this
Yes,
time.
it's the lab that confirm the cases. But when you are showing the sign, automatically you are a suspect. So that is why once they come to the hospital and they say these are what they are feeling, this is what is coming out.
And you mentioned, what are the signs you mentioned again?
Like I mentioned, there is severe dehydration. There is
Regardless of even if you're gulping bottles of water in the last 30 minutes, there's still dehydration coming up.
yes, if there is dehydration, if there is vomiting, and if there is diarrhea. Those are the key things they look at. So at that point, they sample you as a suspect, referring you to the laboratory that can actually carry out the test and clear you for either you're positive or you're negative.
Okay.
Yeah.
All right. So in terms of, you said the lab is very important at this stage. How can we be certain as regards the results we get from the labs? Because there are many cases where results from labs are contradictory or are false. When it comes to cholera, is it a straightforward lab test and result that we get? No, there's opportunity for failed, results. Is it there? Or faulty results?
Yeah, I won't say the results from the lab are 100% accurate, because even machine is not 100% efficient. So you have to go to the hospital first. At that hospital, you see a doctor. A doctor will refer you. So in the hospital setting, as long as Nigeria is concerned, we believe that hospital settings should have all the necessary test reagents to carry out investigation. So any result that comes out from an accredited hospital in Nigeria is considered to maybe probably 90-95% accurate.
Accurate. Okay.
Yes.
Let's look in terms of the NCDC. Do you think the NCDC has been proactive? Because most times when this epidemic seems to occur, that's when we hear the NCDC roll out the drums and start doing sensitizations, and health facilities are being brought up to speed. And with the Jagba syndrome, which the health sector has suffered, is it affecting how we deal with epidemics such as this?
Yeah, it does, but that does not mean that
NCDC
NCDC are not doing their work.
Oh, yeah.
They are. because if they are not, by now, I mean, probably Abuja would have been, because of the, if you I don't know if you move around Abuja, there's a lot of defecation out there and all that. So if there are no measures in place, especially in the primary healthcare centers, I don't think we'll be speaking, having this conversation peacefully. So, and NCDC are doing their best, and Japa syndrome, yes, it's put a lot of pressure on the hospital, but then the health workers are still doing their best.
Okay, so let's look at, we know some states were mentioned, Delta, I think we've got Zamfara, Abia, Nasarawa, and some other states were mentioned as states, I think Bauchi was also mentioned as states that have the issues, suspected cases. I think there's Bayelsa also, Cross River, Nasarawa, and Katsina. We noticed Abuja and some other states were missing. Does it mean there's a reason why these states, because we saw Delta, Bayelsa, which are the same riverine, Cross River, why is it that these states have gotten more of the suspected cases than others? And thankfully, the FCT is not there, but it was the magic.
Yeah, just the way I've said, the riverine area, and looking at the cases, let's use Lagos as an example now.
Okay.
Lagos is more of a riverine area. Now, if we look at, we talked about hygiene. Hygiene plays a very important role in this case. So if people don't key into proper hygiene,
Okay.
this is bound to happen. We talked about properly uncooked food.
Okay.
These people can eat some what's it called, products
Okay,
like
proteins,
raw,
okay.
like raw. Some people eat it raw. Some of them drink water because they believe that they grew up there, they give birth to them, the water cannot kill them. So
this is the kill Africa man, like they will say.
Kill Africa. We grew up in the riverine. So,
Yeah.
so looking at it, I'll relate this to hygiene, which would be either personal or even environmental hygiene. This is what is one of the major things that is making the cases to be more in those riverine area. Then looking at maybe the north and all
yes,
that,
like
yeah.
Bauchi. We're seeing Bauchi, we're seeing Zamfara there.
Zamfara, yeah. If you look at these cases, areas of Bauchi that has been affected, it's either they are close to the riverine area, or they are maybe probably those places
Is it
that
the
have
dense population now?
dense populated
where
area.
hygiene is
exactly. And if you look at those areas, some of them don't even have good water. I don't know if you have been to Bauchi before. Some of them, if you look at where they fetch water from, some dig hole, like they dig a very big hole and be fetching water. We see the water there. It's like, I don't know, like maybe you want
Brownish in color.
yeah, like there's what outside to call shy.
Okay,
Shy.
that's
The
tea
colours-
now.
Exactly.
Okay.
Tea that is what's it called? That is watery. That is how the water looks like in some places. Some of them don't have good water. So I will relate that to probably good source of water and hygiene. We can't rule hygiene out.
Okay, in terms of sensitization, would you hold? Yes, you said NCDC are doing their job, but would you also hold them responsible, all the state government, all the government, in terms of sensitization, the they need for sanitation and hygiene, rather than wait until these epidemics always come out?
Yes, I will not hold only them responsible for this in terms of publicity. We have National Orientation Agency. They are supposed to collaborate.
Sure.
So that they can preach out the cause, the prevention, and the signs and symptoms when you are to report to the hospitals and all that. So if there's no collaboration, if there's no intergovernmental collaboration, and even non-governmental organization, if they don't come in to see how they can come together and how this public awareness about this particular disease, I'm scared it might turn out, it might be more than this in the next couple of weeks or months.
All right, let's look at, you talked about vaccines. When should these vaccines be taken? Can it be taken when one is already affected, or it's supposed to be as usual, before the the infections come out?
Yeah, the vaccine basically is before the infection. If you are tested and you are negative, you take the vaccine. Once you are positive, the vaccine cannot work. If
Okay,
you are
once
positive,
you're positive
yeah, it
already.
can work.
And so, why do they give these vaccines like other vaccines where kids are given even as soon as they're born? Is there a reason?
Yeah, is to prevent this kind of situation, and for instance, they look at the cost of treatment and the availability of preventive measure. So those are the two things that are being weighed. So the reason they are giving vaccine is to prevent complications,
Okay.
especially this complication that is almost 50%, that can lead to 50%. For instance, if you are positive,
Okay.
you are at 50% chance of, the person is at 50% chance of dying. But if the person gets a proper treatment, you have 0.1% or even 1% chances of dying, which is, that means you can definitely be okay. So vaccine is to prevent complications.
Okay.
That is one of the major
reason. Okay,
yeah.
let's look at, you talked about primary healthcare centers, and we know that the government has Mohammed Pate, who is in charge of the health sector, had talked about the federal government's plan to empower and refurbish the primary healthcare sectors centers across Nigeria. How key is that currently? How important will these PHCs be for Nigerians, especially when we have some semi-epidemic like this?
Revitalizing primary healthcare center will play a very vital role in taking care of Nigerians' health. Let's use Lagos State as an example. One of the states, in fact, the only state that primary healthcare facilities are functioning is Lagos State. It's only Lagos State you go to primary healthcare centers that you can see a doctor, you see a nurse, you see a pharmacist and all that there. But
and the drugs are, they have enough drugs.
Available, yes. Before they refer you to general hospital, probably something they cannot do. Imagine there is no, with the cases that are coming up in Lagos now, assuming we don't have a functional primary healthcare centers in Lagos, we won't be having this kind of conversation. You and I know that if you go to general hospitals, you wait for a very long time before they attend to you. So primary healthcare centers are very, 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 very important. And I don't know what the government are doing in trying to bring it alive, because it is the power, because they are the ones that attend to the rural areas. Because if you check, most of the primary health centers are situated in rural areas. So if those people cannot get this.
But healthcare professionals like yourself, not the problem, because we're told that when it comes to sending or deploying health professionals to, okay, I think I'll go for a very quick break. When we return, the program continues. Stay with us.
It's time for sports' biggest moments on global television. The headlines, scores, breaking news, and commentaries on sporty events. Talking with the biggest players, strikers, and about the slam dunks and goals, stunning saves, near misses, and upsets. Let's talk about the greatest home runs, comebacks, knockdowns, and victories. Talk sports with the king of sports, Anthony Momodu. Weekdays, 10 a.m. Don't miss out.
really sorry for that sudden break in transmission, but we're glad to be back. Still watching the Insight today on Global Television, and we're looking at the cholera outbreak across Nigeria, and Lagos being the epicenter. And the Commissioner of Health in Lagos State, Abayomi, has also spoken about the BDT and the mortality of rate in Lagos. Abayomi disclosed that 350 suspected cases of cholera were seen or were reported in 29 wards across multiple local government areas in this state. According to him, there are 17 confirmed cases. 15 fatalities are attributed to severe dehydration caused by delayed presentation at health facilities. But let's look at the issue of delayed presentation. Like Abayomi has stated, that dehydration was one of the causes. Does that lack of early detection, how severe could it be in this fight against cholera? Especially for those who have not even gotten the news to know that, okay, there's something playing out called cholera right now, so they might just think it's just a normal illness or normal diarrhea.
I would say it's very deadly and extremely, let me use the word extremely deadly, because especially in Nigeria, where we like doing self-medication, we wait until it becomes the body becomes so deteriorated before we go to the hospital. In cholera case, people might tend to mistake it for what's it called, normal diarrhea. Then with that, they'll tend to be probably taking other antibiotics to say how they can kill the diarrhea. But living together,
Yeah,
okay.
yeah.
Now, waiting until it becomes serious before going to the hospital is is something that we have to discourage with passion. We shouldn't wait until it gets to that, because you might even transmit it to other people.
Okay, let's talk about the strain, the different strains in cholera. The one discovered in Lagos, according to the Commissioner Akintola Abayomi, he says the strain of cholera that was found in Lagos was very contagious and very aggressive. Does it make treatment across board more difficult now as a different strain comes up? So, in fact, let's say they're treating it in Lagos with such a treatment plan and drugs, but we go to the next state and we're told it's a different strain. Does that change the narratives?
Okay, there are several strains of bacteria, and at this moment, I'm not aware of a new strain found yet, but there might be several. So we have antibiotics that have several strengths to deal with bacteria. So different strain in Lagos will not and cannot affect the treatment, because definitely it must pass through the lab before treatment. So from the lab, we'll get to find out the bacteria that can work with this strain, that can kill the strain the person has. Yeah.
All right, I want to say thank you to Jogba Musa, who is a health personnel, for joining us this afternoon on Insight Today and helping us look at how best Nigerians can prevent cholera by keeping good hygiene and sanitation, and also reporting early to the hospital are the key things you have said. Thank you very much.
Thank you, Anthony.
All right, so that's how we're going to call it a wrap on today's edition of the program Insight Today on Global Television. Still standing in for your regular host, Juma Manson, who hopefully tomorrow will be joining you on the program. That's how we call it a wrap. Let's do this again tomorrow.